and what you can.
Here we go.
Hello, folks. Welcome. We're letting folks in here to our webinar today. You see the number growing. Excited to have everyone here. My name is Vanessa Adams. I'm the program coordinator with Kids Mental Health Pierce County. We're going to give folks just another minute to let folks in, and then we will go ahead and get started. Okay, I can see some people joining us. We'll let them join us as they come, but I'm so excited to be here today. We have Laura O'Rourke with us, and I have been just loving getting to know her more and hearing about all the great things that she's doing. Laura is the founder and executive director of Behavior Bridges. She's a board certified behavior analyst and licensed mental health counselor. She's worked in the field with folks with autism and IDD for over 20 years in a wide range of programs and services in the United States. Since 2015, Laura's work has centered around Behavior Bridges in South Hill, which provides educational and behavioral-based services. Consultation, training, direct therapy, and groups are provided by highly qualified members of the Behavior Bridges team. And honestly, I just could not be more excited. She's a wealth of knowledge, a great support, and has been a wonderful partner to Kids Mental Health Pierce County. We're doubly excited because in 2022, this year, Behavior Bridges was chosen by Pierce County to support behavioral health through the behavioral health tax. And we're really excited about offering these programs and having these connections and collaborations. So really looking forward to hearing about this today. Kids Mental Health Pierce County is a community collaborative, a coalition of folks, volunteers in our community that are working to provide the best services closest to home in the moment that youth need them, youth and families need them. And so we're holding webinars monthly, honoring and listening to feedback from community members around what's important, what's needed. And this is definitely a topic that lots of interest has been expressed from our end as Kids Mental Health Pierce County professionals, families, parents, and we're excited to have these programs in our community. So I am going to turn it over to Laura, who's going to get started for us today.
Thanks, Vanessa. I appreciate it. Hi, everybody. I'm so excited to be here. I'm really happy about all of the work Kids Mental Health Pierce County has been doing, and really happy that I get to share more of our programs with you all today and tell you what we've been doing. So hopefully people have been hearing about this program. We've been trying really hard to get the word out. And if you had any questions or any thoughts or any well, what about this? Then hopefully all of the answers will happen today. So I'm going to share my screen and we'll get going. Okay. So this program, this project that we're doing this year and next year is called Preventing Behavioral Health Crises for Autism and Developmental Disabilities. And it's a partnership with Pierce County Human Services. And the way that this all started was Behavior Bridges started in 2015 because we saw a need for community collaboration in Pierce County, and we are in South Hill, and so our big mission is to help work together to overcome obstacles. And we provide quality behavior and education services. We focus on people who come to us at any part of their lifetime and their lifespan, and we're interested in helping existing communities and existing programs build their supports and their networks and their resources, including families and individuals, and wherever that person may be, we want to help support that community that person is in, rather than build yet another one and have more silos. So what Behavior Bridges does is we provide ABA services, but then we also have provided school and community consultation services, and then our new programs that we've been doing through this partnership that I'm about to tell you about are social groups and social skills classes and caregiver training that is really specific. And so you can find more about us and the programs that we offer on the website, our website, but also I'm going to share with you more of what we're doing. So the behavioral health tax is how this programs, the programs that I'm going to speak about today is funded. And so a little bit of background, in December of 2020, the Pierce County Council passed the ordinance to collect 0.1% sales tax to fund behavioral health and therapeutic court programs within Pierce County. And so it got put into law, and it provides funds for mental health and substance use disorder treatment. And really the goal of this money is to fund services that are not covered by Medicaid, private insurance, or other local or federal grants. And so they began collecting that tax in July of 2021. And right about that time, just a little bit, right about that time was when we started hearing about possibilities that programs could look into what kind of programs the community needs and how can we support the use of these funds to be preventative and address this crisis that we're all shared in knowing about and trying to support and get answers for. And so in March of this year, different organizations were invited to submit proposals that tried to address some of these concerns that the community has had. And so because of that gap that Behavior Bridges has noticed the whole time we've been around, and really with what our mission is, one of those areas of need is the neurodiverse community who experiences behavioral and mental health crises at a higher rate than the general population, and has a really difficult time accessing crisis services. And so the idea that Behavior Bridges had was to continue to do our preventative work, but really target that population and work on providing preventative care and training to people who support and love and who are part of that neurodiverse population. So the goals of this program was to provide preventative services that are going to support initiatives relating to employment services, wraparound services, and early intervention services for anybody that's an at-risk youth. And then our goal is to provide preventative strategies to address challenging behaviors and support people in Pierce County with complex and behavioral and developmental needs. And really, what we all want is for everybody to be successful members of their natural community and their natural support systems. And so this partnership was forged with Pierce County Human Services and Behavior Bridges. And really these are kind of the key words that we're working for, is wanting these programs to be effective and culturally competent, really to increase engagement with our community, especially after the pandemic. We lost so many natural connections and communities, and so to start rebuilding those. Our focus is on people with complex needs. We have a lot of people in our community that don't fit whatever mold it is that they're looking for filling, and to really try to provide something to serve that complex needs group of people that we need to support. Another big component is that we wanted to make sure that we're doing something that's evidence-based, that isn't just a great idea that we don't know if it's going to work. We know that the programs that we're offering in the next year work, and there's research behind them, and we're really excited, and we have our own data from since the summer we've been running these programs, and it's just been fantastic. So I'm really excited to share. Also building resource networks and to decrease stigma, increase skills, and support engagement and community partnerships. So the target population that was proposed in the grant language was those people in our community where safe community integration and socialization are not adequately available through existing therapeutics, schools, or community services. So you don't have any providers in your area, you don't have enough money, the insurance won't cover it, you don't have the right diagnosis, school services aren't enough for what you are wanting for, you're on a wait list. And so any of those things are things that I hear often for why somebody can't access that safe community integration or get the services that they need. And so my big goal with this project was to say, not a problem. The answer is yes. So that's really what I've been trying to focus on is if that sounds like something that somebody's been struggling with, that we really wanted to reduce those barriers. And so if you look at the map, really this focus in the community is anybody within Pierce County. That's where that money is coming from. But as you can see our little heart here, that's where we are. So, so really what we were hoping for is anybody that is in that super underserved areas of Pierce County, really trying to focus on those areas that haven't had access to resources before. And so the message is you're welcome, please come. Yes, let's figure out an answer. Let's figure out some resources. Let's be a connection, or at least a nice soft hand to connect other people. And so a lot with the same passion that Kids Mental Health Pierce County and Pierce County Human Services, all of us working together to figure out how can we really provide those supports. And so all of the programs that I'm about to discuss are the programs through Behavior Bridges that are fully funded through the behavioral health tax, and that's going to be through 2023. And hopefully we can build other partnerships and make sure that this continues to be a sustainable program. That's my goal with all of these. So the first program that we are offering are social groups. And so really what this program is just a fun drop in, hang out, have a great time, come to our center and play with people of your same age group and hang out. And so we had a smashing, rowdy, awesome group last night of 8 to 12-year-olds. And we ended up having different kids come in, a couple of siblings come in, parents connected afterwards and had coffee, it sounds what I heard. And so we're really, our goal is to really focus on those kids who don't have access to services. Those early intervention services have gone away. You can't get into, T-ball or other natural community social activities anymore, or they just aren't for you. And working on just having a place to be, a community where you're welcome. And just because there's a couple of things that we need to know about doesn't make it a place that you're going to be excluded from. We want everybody to be welcome, and we want to make sure that we have the resources that you let us know what you need, and we're going to try to figure it out. And so far we have been able to accommodate almost everybody, and the people that we are wanting to be a little bit more cognizant of how we support that so it's fun and safe. We already have plans for and are working with those families so that they can access this too. And so that target area through the grant language is 8 to 12, but we're also noticing there is just a huge need for this type of support and services, and that it really is contributing to preventative mental and behavioral health care. And so we do have options for all of the different age groups that you see here. We even thought about having a social group for caregivers where it's just caregivers and family members come in and say hey and meet each other. So, and we're going to be doing role play groups. We're going to be starting a Dungeons and Dragons group in the new year. And so we've already, and then all of these other age groups we've been providing already, and they've been really successful. People have been really happy and have come back. We have a really wonderful group of people that are like, when's the next one? So that's exciting. Participant requirements. Anybody can come. So we want people to be safe, and we want people to have fun, and we want people to enjoy themselves. And so if we all work together, then that's something that we can do. So our goal is to not have exclusionary criteria, but we are kind of basing it by age so that kids and people can meet others within their own age group and start building their own social networks. There are no referrals required, but really this is about, is this something that, based on what I've been saying, it sounds like it would be fun and it sounds like it would be something worth trying, then great, come. If somebody that you love or somebody in your own network at school or in your community says, hey, you guys might be interested in this, then that's a referral, try it out. Our social groups are about an hour and a half right now. We're going to be doing a little bit longer over the holiday break. And then we're also going to be doing some summer camp type groups as well. And so those might be a little bit longer and more frequent, but it's only an hour and a half to try it out and see if it would be a great community for you. And if it's not, then people are welcome to say, hey, this isn't for me. I'm going to go grab some Dairy Queen. So the cost is free. We do not have any wait lists right now, and people are welcome to come as much as they'd like while we have this available. And so I will say that we're filling up with our December dates, but beyond that, we have a few extra dates that are still left over, and depending on the age group, and then we have plenty of options in the new year for anybody who wants to come. So where are we? We are on Meridian in South Hill. And if you know where Sunrise, the Sunrise Center is, and you know where the Dairy Queen is, then we're right there, and South Hill Library. And so we're working really hard trying to build all of those connections. And so if you go in this little door right here, that's where we're at, and we're excited to have you. So the schedule right now, you can see that I have the winter schedule up. We have some dates in December that we are still working on for 5 to 7, 8 to 12, and 13 to 17. We actually are getting a group of toddlers available that we've had some interest. They're like, why don't you have a toddlers group? And it's like, oh, I mean, we could get one. And so we're piloting some younger ages as well. And the 2023 dates are not coming soon. They're already up on our website, and you can go onto the website into news or new events and see the 2023 calendar. And so you can register for any of those programs. How to register, you would go to our contacts page on our website, and there are these wonderful colored buttons, and you click which one you want, and it'll bring you to just a quick screening page. So we have some basic information so we can contact you back and know just a little bit about the person who's registering, so that we can make sure that we accommodate whatever you guys need. And so that's how you register, and then we'll get you hooked up with the right date. So those are our social groups. The second program that we have available is Peers. And Peers stands for the Program for the Education and Enrichment of Relational Skills. And but this program is out of UCLA. And it's world renowned. And also they've been showing for years that this is an evidence-based social skills program for wide ranges of people with autism spectrum disorder, ADHD, anxiety, depression, other social emotional needs. So it's really been something that they've been studying for a long time at UCLA, and we're always looking for social emotional programs and social skills programs, and sometimes they're kind of hit or miss. So we really wanted to make sure that we were providing social skills programming that you come and it will be beneficial, and it will be something that will be a positive experience. And we're just finishing up our first peers group. Next week is our last week. They all voted that they're having an ice cream social. So I have a huge list of all sorts of things that I have to buy this weekend. But they're graduating peers. They've completed the 16 week program, and I would say at least 80% of either the participants or their caregivers have come up and said, what did you guys do? Because they're doing things and enjoying themselves and hanging out, and there's free time after the lesson that is of the day for everybody to just mingle and hang out. And most of the kids are staying after to just hang out and play. We have a foosball table. That's the new hit right now. So we're really excited. And then we also have 3 staff who've completed the peers training that are certified peers trainers for this program. So facts of peers at a glance. This is intended for motivated adolescents, young adults, and then there's also a new preschool program that is out there that as soon as they get that manual to us, we're going to be starting peers for preschoolers. But all programs meet once a week for 90 minutes over a 16-week period. And then the participants can attend with a parent or caregiver who learns how to assist that person in practicing and maintaining the skills that they've gained. So that is more than welcome, or that person can attend on their own. Either one works. And what peers does is it teaches ecologically valid social skills that address core deficits in autism and related social skills areas. And so a little bit more about peers. It's one of the few evidence-based parent and caregiver assisted social skills programs. It's empirically supported, and it's been translated all over the world and used all over the world. So it is well established, and it works. And so I like as a provider when you try something and they say it's going to work, and then you're like, I don't know about that. And so I'm really excited that we're at the end of our first pilot, and I'm like, oh my gosh, it's so fun. It's so exciting. And everybody's having a blast. So it's been really cool to see. So what are the participants going to learn in peers? So this is an example of the topics for every week. Trading information, starting and maintaining conversations, finding friends, how to do electronic communication, and what does that entail? Appropriate use of humor for different scenarios. Entering group conversations and exiting conversations, how to do get-togethers. Dating etiquette is something that we offer for our adult peers program, but because we're offering 13 to 17-year-olds, we're not getting into how to date yet for our adolescent group, but our adult peers, we are getting into those topics. Handling disagreements and bullying, and then what to do with all of that information and how to move forward. And then there's a graduation party at the end. So that's what people can expect when they come through peers. There is not a referral process, it's self-referral, but it is definitely for people who want to be there, who want to learn, and who want to be part of those skills. It's going to be best for people who are able to understand verbal language and video modeling and can participate in the role plays, but there are lots of modifications that we can make as far as that's concerned too. So, and we also are offering social skills groups that are just social groups without the curriculum for anybody that might not want that full intensity of that 16-week program, because there is a commitment to complete it. And so it is a commitment. It's like going and having a soccer class or signing up for a sporting event or anything like that. So that's another component that needs to be considered for people. And then caregiver assisted is something that, caregivers it's best when everybody works together. And so caregivers who are also interested in supporting the person that's participating, these 3 things are going to show the most benefit. Also, this program is free. And so for this program, we also don't have any wait lists. We are getting close to being at full capacity for our peers in person for January, but there are still, I think, 1 or 2 more slots left. And then we are also offering a virtual program in January as well. We can also coordinate peers programs with other community partners. We're working on trying to build some networks with different school districts and libraries, et cetera. And so that's something that we can talk about as far as bringing it to to the community rather than you guys coming here. But this program is a one and done. So once you go through the program, it's not, you wouldn't do it again. That would be where we're going to teach you how to build your own social networks and your own community, and then go live your life and have a good time with it. Here's the calendar for our 13 to 17 peers group, and then our 18 and up group. So like I said, we have in-person cohorts and virtual cohorts that are going to be offered in the new year. And so that's all, that information is up on our website, and we can get more information to you if you email or ask us any questions.
I actually do have a question in the chat for
Yes.
you.
Okay,
I know
great.
that I got the green light to raise them as I came.
Yeah.
So one of the questions that came was, can you compare and contrast this program to typical offerings from the Boys and Girls Clubs or YMCA programs?
Yes. So what this program, what Peers is it is built off of a curriculum. It is a social skills class. And so, so what this program does, rather than coming in and maybe this person's talking about the social groups, just the drop-in groups. But for Peers, it's a set curriculum. And so the participants are going to have a topic, and there's videos, and there's instruction on what does this topic mean with examples. Then everybody breaks up and does role plays. And then there's time for any brainstorming or other things that come up for each week. So that's for Peers. If the person that just asked that question is talking about social groups, the difference is our training and our backgrounds and our ability to accommodate complex behavioral needs. And so whereas Boys and Girls Club and the YMCA or other after school programs definitely are wonderful. My kids went through them, and I'm highly supportive of them. This program, any of the kids that participate in those programs would be more than welcome here. But also kids who maybe have struggled in those programs because of high ratios, or just needing a little bit more TLC or a little bit more supervision, or maybe have some more complex needs that have just made it a little bit more challenging. That's something that we're really trying to focus on not being an issue here. And so we've had participants in our social groups come where there's anxiety at play and they don't like being around big groups, or they're not comfortable with that. We've had people who have had a hard time with impulsivity with peers and not knowing how to problem solve, and then, sometimes getting into a little bit of sticky situations in some of those environments, or where staff just aren't sure what to do in that case. So all of our staff are highly trained. Half of our staff are board certified behavior analysts with master's degrees with human development backgrounds and all that kind of stuff. So the staff training is something that we have that a lot of those other programs don't have that type of capacity or that type of training. And so because of that, though, we have been really successful in being able to make sure everything's still safe and fun. Because fun is the main part. And so the drop-in groups and the social groups are really not meant to have a curriculum in place. It's meant for just people to have fun and be together and hang out. But then the supervision and the ratios are really low. And so we can accommodate more complex needs. So hopefully that's an answer to that question. Gina, was there any more questions?
Not that I can see so far.
All right, fantastic. So you guys have seen this part up on the screen, so I'm going to skip that because we already talked about that. Registration, you can see it's the same page. It's the purple button for peers. And this is the same registration for adolescents or adults. And then we'll help funnel through which group is going to be most appropriate, and whether it's online and what the dates are. And we'll hook everybody up with that once we get that information. So our third program that we're offering through this partnership with Pierce County Human Services is a program called Safety Care for Families. And this program is one that there's a lot of of caregiver training program, or there's a lot of caregiver training programs. There's also a lot of crisis intervention programs that are typically offered just for human services staff, school district staff, et cetera. And so what this program is one that kind of combines the two in as bite-sized as you can get for learning about how to identify and prevent challenging behaviors. It's meant for caregivers or family members, and it's meant to give ideas and brainstorms and teach people how to support challenging behaviors in their homes and natural environments. And really the focus for this program is on prevention and safety and humane, supportive, evidence-based interventions. And so while Safety Care does provide more advanced training, we will not be through this program. We're only going to be focusing on preventative measures that avoid crises, and also how to manage a crisis until an emergency responder can arrive. So, so just from a who is this for and what are we going to be going over? We're not going to teach any type of techniques of this is how you handle physical behaviors physically. It's all going to be about prevention and making sure that we help teach and identify preventative strategies, and then how to get out of a crisis before it gets to a point where we're worried about safety. If you want to learn more about the program and the company that has done a lot of research in this area, that's QBS, and that link is right here on the slide. So facts at a glance about Safety Care for families that we're going to be doing through Behavior Bridges. It's a 3 to 5 hour training, and it's dependent on group size. So one of the cool things about QBS and Safety Care that I really like is it's a competency-based training, which means that we want to make sure that the participants get what it is that we're working on, and we're not just sitting there, talking and then you just leave. We really want to make sure that that information is absorbed, and that we have enough of a ratio that we can really have a good conversation about what we need to do. And so they dictate that for a small group, up to 3, that it can just be both parts, both 1 and 2 sessions can be done in 3 hours. But then if it's a bigger group, up to, I think, 15 participants, then that's going to be a 2-part, 2.5 hour, or a single day training. Our staff have gone through all of the Safety Care training and are certified Safety Care trainers, and then participants will get a certificate of completion. So different things that the caregivers are going to learn. So this is right off of QBS's website, and there's an essential skills part 1 and part 2. And so these are the programs that we're offering through Behavior Bridges this year. And so those essential skills part 1, collaborating with professionals, legal issues and responsibilities, understanding challenging behaviors, and then how to provide a supportive environment, how to provide a safe environment, and then some personal safety techniques that can help prevent injuries. How to look at caregiver behavior and how it might contribute or support de-escalation, and therapeutic use of reinforcement and differential reinforcement, which we get into on what those are and how to do them in that part 1. And then part 2 gets into identifying things that might come before a challenging behavior, how to have your body and what's called a safety stance, and how to stand so that we're preventing injuries and possibilities of injuries in times where that might be a concern, how to do de-escalation techniques, and then coming up with a comprehensive family safety plan. So those are the nuts and bolts of the things that a caregiver would learn in this program. Is there a referral process? Any parent or caregiver is welcome. We've had parents of toddlers who are like, oh my gosh, this is fantastic. I'm going to use this while I'm putting him in a car seat. And so I don't get smacked when they're flailing and we just need to get in the car. And then I've had caregivers who are caregivers of adults who have had different emergency services. So and I went through as a caregiver as well. I'm a parent to 13-year-old neurotypical kids and was brainstorming how to not scream at them about raking the leaves. And so it's a good training for any caregiver. And if anybody ever gets a little heated or a little escalated, it's really good skills, and it's worth the 3 to 5 hours of the time. It's also in line with many of the programs that are out there that agencies and school districts are using. And so it's another way for parents and caregivers to get an idea of what might be going on and what the training of other people in their networks might be. So that communication and that language is consistent across all of those environments for that person. So that's really who's invited to come and who's welcome to come. It's anybody. But that's what we're going to talk about. It's also free. And it's a single class. So once you're done with part 1 and part 2, then, there's no need to come back. We're also offering in-person and virtual opportunities, and we have open slots available. So, so give us a call and put in a registration form, and we'll make sure that you get in to whatever works for your family. 2023 dates are available for both in-person and virtual. We also can come to you and provide custom groups of 3 or more by appointment. So if that's something that there's a group or anybody that would like members of my family would like to come, but we don't want to be with other people, then that's fine. We can get some dates together too. So registration for safety care is the what is that? I guess that's marigold color. And then that's the registration for that. Another thing for you guys to know is that if you register for one of the programs, then when we call you, we can get you hooked up with all of them. You don't need to do 3 different registrations. We just want to make sure that we have the information, and then we'll get you signed up. For navigating information, our website is behaviorbridges.com. And if you click on new events at the bottom of the page, you will get hooked up to all of the flyers that we have, any new updates. I put in the 2023 calendar this morning, so that should be in there. And you can find the programs and the dates you're interested in, and then fill out the registration online. You can also call us or email us, and we'll get you signed up. And then if you want to be part of our listserv, you can email info@behaviorbridges.com, and that's also on our website, and let us know that you want to know more, and we'll hook you up into our email list and make sure you have continuing information for our summer dates, and beyond. And then if you need any individualized options for peers or safety care, that's something we want to be able to accommodate. So we just need to know a little bit more information so that we can do so. Registration in general, you can register for all of the programs that fit your needs. You don't need to, it's not just, oh, I did one, so I can't do any more. So safety care and peers are one person one person, one program, and then that's done. But then the social groups, we're hoping to have continued maintenance with those dates and those groups so that people can really build those networks together. Let's see. So another thing that I really wanted to highlight was all of the community partnerships that we have been making and have continued to make and continue to be appreciative of. But these are just some of the organizations that we've been partnering with who've taken time out of their days to talk with us and to share information, and have kind of gone above and beyond to coordinate some services. So any partnerships that we can make through this process, we really want to take advantage. We want to do more together rather than all separately. So anybody that wants to get on board, we would love that. And I wanted to also make a specific thank you to Kids Mental Health Pierce County and Pierce County Human Services for these opportunities and these partnerships. And we're just really, really excited to have this be a resource for the community. This is something that I've had dreams for a really long time. And so I'm just really grateful that we get to do cool stuff. If you need to contact us, the email is info@behaviorbridges.com, and then our website is behaviorbridges.com. phone number is 253-262-3409. And myself or Sarah or Danielle or Becca or Desiree, any of us are available to help support you guys in anything that you need. So if anybody has any questions, now's the time, and I'd be happy to answer any.
There are some actually. So now that I've got my mute to cooperate with me, one of them is Peers currently running for 18 and older?
Yes. Yes, it is. We have a program. We're taking registration for our January cohort, and we're really excited about getting that group in.
Wonderful. The next one is if you could share what QBS stands for.
Ooh, that's an excellent. I think it's quality. Oh, you know what? I'm going to check because I don't want to misspeak.
We love our acronyms, but
I know
professionals have to double check.
It's the company that wrote Safety Care. How's that? But I'm going to get it for you because Quality Behavior Solutions. Oh, I was going to do it right. But it stands for Quality Behavior Solutions. It's a program that that trains organizations and supports people who experience challenging behaviors. So they have crisis prevention programs and all sorts of programs. The closest I can think of it is like similar to Right Response, CPI, some of those types of de-escalation trainings. But the one thing that stands out for QBS is they provide that caregiver training up front, and it really is that preventative focus, and so I've been trained in all of them and through the years and have so but I like that they have that caregiver, everybody working together and being able to do the same things all the time every time. Yeah.
Great, thank you for double checking. And the next question that we had in the chat was, do you help parents and caregivers learn to identify and understand and respond to the needs and underlying an individual's behaviors, or is the focus on extinguishing the behaviors?
No, the focus is on let's look at the environment. Let's look at things that might be contributing to the concern. How can we be preventative? How can we support the person? It's very supportive and preventative. Nope, it doesn't get into any more restrictive, extinction-y. We don't even touch that.
A lot of passion behind that nope, I can tell. Another question that we had is, to what extent were/are autistic adults involved in both developing and implementing this program and the EBTs that are being implemented?
Okay, hold on. I got to read that one.
So this is on the answer. It's about maybe the second from the bottom, the 334.
So autistic adults were part of this program and we have an autistic advocate on staff who has been part of providing guidance and resources and checking and making sure that the grant language and that the program is what we all want it to be, and so autistic advocates have been actively part of this process, and we've sought that out from the beginning through all of the stages, and now have somebody on staff who's supporting that quality and making sure that we're doing it right. That's a great question. Thank you.
This next one might have to be read too, just to make sure I honor the acronyms. But the next question is about the safety care training. Do you liaise with local MOCT/DCR and co-responders? And is that information included with a follow-up of, are there any post-crisis resources or networking contacts?
We are not actively coordinating with those organizations through this. This is a standalone caregiver resource. Because one of the things that we wanted to make sure was that, there are so many organizations and people involved in crisis intervention, but what can get lost is making sure that caregivers and family members have those same tools and resources and information once the handoffs back at home and back in the community. And so this is an opportunity for us to really be able to give those resources and those tools directly to the caregivers and families. I would love it if it's a preventatively given and that nobody ever has to learn any new acronyms for crisis intervention. That would be the ultimate goal, right? So no, we'd love to partner and coordinate and build those resources together, but this is independent. We really wanted to make sure that these resources are just available for anybody and they don't need any special referral. As far as resources or networking contacts, you're in it. Kids Mental Health Pierce County is my go-to networking for when I need to figure out who I need to connect somebody with, depending on the situation, depending on trauma backgrounds and mental health and all sorts of different complex behavioral needs. So I usually just go to Kids Mental Health Pierce County website and I'm like, who should I call first? And I haven't been stuck when I've used that resource. So you're in it.
Well, I'll say thank you on behalf of African Mental Health Pierce County. I'll say that you got your own thank yous. You got a shout out from Richard,
Thanks,
appreciating
Richard.
all the work that you're doing, which is great. And then I see two more, I guess, geographical questions, I'll say, so I'll kind of lump them together. Yeah. Rebecca asked if residents of other counties can use this service or if it's strictly for those living in Pierce County.
We are prioritizing people who are living in Pierce County, and we're really prioritizing people where those behavioral health tax dollars, those taxpayer dollars, are being contributed. So if somebody is contributing to that tax dollar, then that's who we're prioritizing. However, if people call and they want to come and we have extra room, they're more than welcome. So yeah. And right now we have enough availability for whoever. So we just want to make sure that we're prioritizing which taxpayer dollars are being used, but also if there's room, then people are welcome.
Great. And then I guess as a follow-up there's a question about if there's any capacity to help with transportation for people who are interested but live further away.
We don't have, we can look into partnering about transportation funding, but that's where we're trying to offer those virtual opportunities for safety care and for peers. And then there was discussion in our morning meeting yesterday about maybe we could do a Zoom group. And I'm like, oh, I don't know if anybody wants to do more Zoom social hours, but if we had interest, we could. And then also that's why we're working to be able to coordinate peers and safety care where we come to others. Yeah.
Great. And this is kind of similar to one that was asked before, but there was a comment that there wasn't any agencies seen on a slide that are led and or primarily staffed by autistic adults, and that they really want to be mindful of the disability community statement of nothing about us without us. So there's a wondering if there's been any barrier to partnership with these agencies.
The different programs have been contacted. We've been partnering with autistic adults and 100% agree with that statement. And so that was just who's emailed us back and called us back and taken a meeting. So we've sent out, I think, something like over 630 individual emails to everybody we can think of to try to make sure that we're making meaningful partnerships. And so who's represented on that slide is certainly not everybody we've tried to contact. It's just who took time out of their day so far. So we're hoping to keep that list growing and building, and I agree with that statement. Thank you for highlighting that.
And the last question that I'm seeing so far is about the growing resources. So there's a question from Joe about if you're familiar with the telecare program in Milton that has 8 beds for ID and DD individuals who are detained.
I have heard about it. I'm not intimately familiar with it.
Great. Well, I will say that we got through every single question and a full presentation. I'm going to
You have
keep
10
my
minutes to
eyes on the
spare.
chat.
That's
I
fantastic.
know, look at you go.
You guys get, what do they say?
And
You get the gift of time.
the gift of time. Vanessa did drop in the chat for all the kidsmentalhealthpearscounty.org website, where you can find those resources that were mentioned. We always record these webinars, so if you want to come back or share them, you're welcome to do that. Vanessa, with the gift of time, is there anything else that you'd like to share that maybe we can close out with?
No, I would just like to extend my thanks to everyone for attending. My thanks to Laura for these incredible programs, for highlighting the need in our community, and for just being here and being a partner. kidsmentalhealthpearscounty.org has a bunch of resources for crisis support and active crisis support resources that Laura spoke to, as well as additional preventative and partner resources. So please always reach out if you have questions, connect through our website, and engage with these incredible programs and partnerships that we do have in Pierce County. So grateful for the rich partnerships that we have and the incredible collaboration we have in our county. So thank you all for being a part of this. It's how we make a difference. So appreciate you. We'll have a recording on the website, and please feel free to share it amongst your colleagues, friends, families that might benefit. So thank you again, everyone, for joining us today.
Thank you.
I will say, Vanessa, that one more question did get squeezed through. So for everybody that's dropping off, have a wonderful evening. The last question, I'm glad I clarified, was Megan had asked originally about not hearing the first question asked about the adult social groups. They had found the 18 plus peers one. I had asked if that was just about the peers class, and I was told that it was a different program.
We
I
have,
don't know if I can.
so we
add
have
more.
a peers for adults. And then we are doing some just drop-in social groups for adults also in the new year.
And Megan, if that answered it, wonderful. If not, I'm going to keep my eye to make sure.
Otherwise,
you get
just
the
email me
information you need.
and yeah, we didn't have that initially in there, but then there was interest. So we're trying to, this is meant for people in the community to get access to things that they think are important. So so we're trying to pivot and accommodate when we get new ideas and information as well.
Mm-hmm. I absolutely would encourage.
I kept out for the flyer.
Perfect. Yes, that's what I was going to add. I would encourage folks to look out for dates, times, and flyers, as well as encourage additional community partners, autistic self-advocates, or groups or organizations to engage with either Kids Mental Health Pierce County, Behavior Bridges, and continue to grow these connections to improve all of our work to engage those who are living their truths. So please help us to expand and join together with us as we seek to collaborate and support those around us. So thank you again. Appreciate everyone for being here, and enjoy the rest of your afternoon.
Bye, everybody.